Today we will be discussing about conversion reaction. Now, what happens in conversion reaction is that some physical symptoms are manifested by the patient, but they do not have any known physiological explanation. This conversion reaction was originally known as hysteria. It was previously termed as hysteria, but later on Freud coined the term conversion to permit dissociation between the symptom of conversion and hysterical personality disorder. Charcot demonstrated that this could be induced by suggestion. He also viewed that it is a hereditary disease, but Freud actually gave us a new etiological concept where the somatic factors of psychological origin were held responsible for the development of conversion reaction. Conversion disorder involves a pattern in which symptoms or deficits affecting sensory or voluntary motor functions lead one to think that the patient has a medical or neurological condition. However, upon a thorough medical examination or checkup, it becomes apparent that the pattern of symptoms or deficit cannot be explained by any known condition. That is, no organic cause could be traced. Actually, psychological factors were found to be etiologically linked in various ways, like the temporal relationship between an environmental stimulus that is apparently related to a psychological conflict or need. It is the initiation or exaggeration of the symptoms. Secondly, the symptoms enable the individuals to get support from the environment that otherwise might not be forthcoming. Thirdly, the symptoms after appropriate investigation cannot be explained by known physiological disorder. Fourthly, the symptom is not related to pain or disturbance of sexual functioning only. And lastly, it is not due to somatization disorder or schizophrenia. That means if we trace the conversion reaction in the psychological origins, these are some of the way in which the psychological factors are entwined with the diagnosis of conversion reaction. Now, Freud used the term conversion hysteria for this disorder because he believed that the symptoms were an expression of repressed sexual energy, that is, the unconscious conflict that a person felt about his or her sexual desires, and that was repressed. However, in Freud's view, the repressed anxiety threatens to become conscious, so it is unconsciously converted into bodily disturbance, thereby allowing the person to avoid having to deal with the conflict in reality. For example, a person has a guilt feeling about the desire to masturbate. Now, this might be resolved by developing a paralyzed hand. Now, this is done unconsciously, so the person is not aware of the origin or the meaning of the physical symptom, and obviously he is free from the anxiety that he has actually. Freud also thought that the reduction in anxiety and intrapsychic conflict was the primary gain, but he noted that patients often had many sources of secondary gain as well. Now, we will discuss obviously what are the primary gain and the secondary gain. Primary gain is actually the development of the symptoms. The symptoms that I really want to feign, the ones that I want to develop, the manifestation of those symptoms are primary gain for the patients, and the associated sympathy, attention, affection, that one gains in addition to the manifestation of the symptom from the surrounding, from the family, from the friends, are the secondary gain for the patient. In conversion reaction, the patient enjoys both the primary and the secondary gain. The range of symptoms for conversion disorder is practically as diverse as it is for physically based ailments. In describing the clinical picture in conversion disorder, it is useful to think in terms of the 4 categories of symptoms: sensory, motor, seizures, and mixed presentation of the first 3 categories, that is sensory, motor, and seizures. Sensory symptoms or deficits, conversion disorders can involve almost any sensory modality, and it can often be diagnosed as a conversion disorder because symptoms in the affected area are inconsistent with the known anatomical sensory pathways. Today, the sensory symptoms or deficits are most common, and those are actually like the visual systems are affected. Patients report blindness or tunnel vision, partial blindness. Sometimes it is in the auditory system, that is deafness, or in the sensitivity to the feeling, like somebody cannot feel something. It's like an anesthesia. That part of the body is not feeling any somatic sensations. With conversion blindness, the person reports that he or she cannot see, but he can navigate about from a room to other without bumping onto furniture or any other objects. So if somebody is actually blind, she or she will be having problem in navigating in the house also, in the known area or in the unknown area, or in the simple room also. If that person is growing blindness, then, but in case of the conversion reaction pattern, it is seen that they are reporting blindness, but they do not have any problem in moving around in their own house, moving around in their houses or in their room. Next, in the motor symptoms or deficit motor conversion reaction also, it covers a wide range of symptoms. Symptoms like conversion paralysis, like a single limb or an arm has a problem, and the loss of function. The selected part of the body is losing the function. For example, a person may not be able to write, but he may be able to use the same muscles for scratching. Like if he wants to scratch or having a problem with it for any itching or like that, he can use the muscles, but he has developed a problem in moving the limbs or in writing. Now, seizure is another common conversion symptom. This actually resemble epileptic seizures, but it is very easily diagnosed. It can be easily diagnosed of conversion disorder, like by using EEG, because in case of the epileptic seizures, the person shows certain EEG abnormalities. But in case of the conversion seizures or the pseudo seizures also, they do not have any EEG abnormality. And in addition to that, they are unlikely to the epileptic seizures because here the patient also does not show any confusion or loss of memory afterwards. But in case of the true epileptic seizure patients, this is a common feature where they develop a problem in their memory. They have a confusion and loss of memory after the seizures. Convulsions and the conversion seizures, this can be also differentiated in very simple way. Like in conversion reaction, there is no true loss of consciousness. And in addition to that, there is no change in reflexes also. That means that when the person falls, he or she does not hurt himself or herself. But in case of the real convulsions, the person does not have any charge of the reflex, and they can fall and hurt themselves. Tongue biting is very common and natural in case of the seizures, in the epileptic seizures, but this does not function in conversion reaction. In convulsion, there are toning, cloning phases, if somebody is aware of the epileptic seizures, then they know they have toning cloning sessions, but in case in toning cloning phases, but in case of the conversion reaction, we do not have such features. In convulsion, it does not occur at any specific time. It can happen anywhere. It can happen if somebody is in the kitchen. It can happen if somebody is in the toilet. It doesn't matter where the person is. But in case of the conversion reaction, the person will develop the seizure only in the presence of some spectator. If somebody is there to attend them, only then they will be developing the seizure. There are also certain typical features of the patients of conversion reaction. This patient, they describe the symptoms in unusually dramatic and exaggerated way. They often elaborate endlessly on the symptoms. In spite of such descriptions, they actually are unconcerned about the potential threat to these symptoms. Like if somebody is showing that I am going blind, I can't see. So this is something for a normal person. If that person is going blind, he will be so much concerned about the threat that I won't be able to see anything. I'm totally blind. But in case of the conversion patients, they are more concerned with the symptoms, and they actually are indifferent to the potential threat, that they have to their system. This type of attitude is generally called the labile indifference. Secondly, this patient tend to crystallize that areas of the body that have been previously afflicted by physical disease or have been the focus of special attention. These things are called somatic compliance. This means that if somebody have some problem in the colon area, some infection, previously they had a problem in the colon area and that was genuine case. Now they'll try to develop or manifest problems or symptoms relating to the colon area of the body, so that actually becomes convincing that they have a problem or they have developed a problem again. So this is a somatic compliance. Then another thing, these symptoms frequently pattern themselves after a symptom observed in some other persons. The identification with this other person is facilitated by the recognition of similar motivation inferred in the person who originally experienced the symptom. This is also called hysterical identification. Now, what happens if the patient has noticed this type of reaction symptoms in some other person? That was genuine. That person genuinely have a problem in that area, and they have seen that that person, after having that problem, after developing that problem, has gained so and so things. Now, if that gain, that motive is aligned with my unconscious desires, then the patient can align the symptoms in the way that person has developed it. What will happen? I will also acquire the same gains that the person actually got by developing those symptoms originally. Okay, so there are certain, these are the things that we take into account when we see conversion reaction, and we distinguish it from the other disorders, other physical disorders. Now coming to the etiology of conversion reaction. From the Freud's psychodynamic hypothesis, he postulated it as a traumatic theory of neurosis that assumed that the patient is a passive victim of childhood parental incest. The traumatic theory rapidly gave way to the instinctual theory of motivation. It was postulated that conflicted infantile wishes lead to conversion reaction. Freud also postulated that the hysterical patients were found to be fixated at the phallic genital level of development. The threat of castration was a danger situation associated with this disorder. They used denial or repression. The personality structure of such patient is described to be primitive and immature. The conflict may be related to unconscious sexual impulses and aggressive impulses. This can also be explained by interpersonal communication and psychosocial adaptation of the person. Such individuals find the symptoms as powerful weapons to influence their environment. The helplessness can be used to control their family members. So, this can be a cause for developing conversion reaction. Well, our knowledge of how to deal with or treat conversion disorder is extremely limited. However, some hospitalized patients with motor conversion symptoms have been successfully treated with a behavioral approach in which specific exercises are prescribed in order to increase the movement or walking. And then the reinforcements, like any reinforcement of the abnormal behavior, are removed in order to eliminate any source of secondary gain. This also proved to help. Then in some studies have shown that hypnosis combined with other problem solving therapies, and there are also some suggestions that hypnosis or adding hypnosis to other therapeutic techniques can also be useful. So this is all about conversion reaction. If you have any doubts, you can reach out to me or comment below. Thank you, class.